Good afternoon. Today would be our lecture on non-communicable and chronic diseases. Our learning objectives for this lecture would be to define non-communicable diseases, to determine the risk factors for developing non-communicable disease, and assess the burden of disease of NCDs based on available data, and develop strategies to address NCDs in the local setting. So what are non-communicable diseases? These are health problems not caused by infectious agents, as we have learned in the epidemiological triad. So they are not passed from person to person. It is generally of long duration and slow progression. This is previously known as chronic diseases. So it is any disease that can be effectively managed over years or decades but could not be cured. Examples are which would be HIV, diabetes, hypertension, and the like. It is not directly transmissible from person to person, and it spans years, often decades, and in some way degenerative. It relates to aberrant or declining function in some body part or system. This is often propagated by fundamental physiologic imbalances or disturbances such as inflammation. So this would be the epidemiologic transition between comparison between infectious and lifestyle non-communicable diseases. Infectious would have a high mortality on the onset, slow decline, while lifestyle NCDs would have a slowly progressive development, eventually leading to mortality. So total non-communicable deaths by the World Health Organization region comparable estimate in 2012 says that 38 million non-communicable disease deaths in 2012 and 68% of deaths worldwide. In the Philippines, this is the percentage of population living in the urban areas afflicted with non-communicable disease. So estimate would be a total of 67% of total deaths, the leading of which would be cardiovascular disease. So these are the four major non-communicable disease. The first would be cardiovascular disease, cancer, chronic respiratory diseases, diabetes. Other examples of non-communicable diseases would be injuries, poisoning, nutrition deficiencies, genetic orders, disabling disorders, and substance abuse. So the probability of dying from the four main non-communicable diseases between the ages of 30 and 70 years with comparable estimates in 2012 is shown in this world map. Just goes to show that most of Russia and parts of Asia, including India and the Philippines, would have more than 25% uh, weight of probability of dying from these four main NCDs. The probability of dying between ages of 30 and 70 is 28% in the Philippines, which is more than the 25% threshold set by the WHO. And you will see that more of this would be found in the male category compared to the females. Reasons for the prominence of non-communicable diseases. We have the evolution of the aging population because of advancements of technology, decline in birth rate, increased survival to the old age. We get old and eventually get diseases of old age such as cancer, hypertension, and diabetes. The impact of technology seen in automobiles, lifestyle changes, addiction in tobacco, the single largest cause of preventable morbidity and mortality, lack of physical activity, and the emergence of different social and behavioral factors. And 10 controllable factors in prevention of chronic disease is the following. And you could see it's really preventable. Tobacco, having a good diet, having good activity, avoid alcohol, hand hygiene, decrease exposure to microbial agents, decrease exposure to toxic agents, responsible firearms, responsible sexual behavior, responsible driving, and avoid drug use. The four key metabolic physiologic risk factors would be the following: raised blood pressure, overweight and obesity, hyperglycemia, and hyperlipidemia, which if seen in one individual would could be summarized as the metabolic syndrome. And attributable deaths due to the leading NCD risk factors would be elevated blood pressure, tobacco use, raised blood glucose, physical inactivity, overweight, and obesity. Still, as you could see, by doing primary interventions, we could easily avoid disease. So, the importance of non-communicable diseases as far as mortality is concerned, that it represents 40% of all deaths in developing countries, 75% of which are in industrial countries, with cardiovascular disease remaining as number one, and cancer the third cause of disease. They are responsible for some 25 million deaths worldwide, and two-thirds of this would be in developing. Epidemiologic transition, the burden of disease would shift from communicable to non-communicable. Although for now, due to the coronavirus, it's easy to forget these NCDs because of the emergence of a very infectious communicable threat in corona. Mostly in Asia, CVDs are the number two leading cause of mortality, and almost 1,000 die of cancer daily. Hypertension is up in India, Indonesia, rising sharply in Africa together with diabetes. RHD is a major cause of premature death, and in Eastern Mediterranean, obesity, diabetes, and circulatory disorders. Many are disabling in such a way that these are degenerative conditions that limit functional capacity and limit activities of daily living. These degenerative conditions that affect the bones and joints are the single most important cause of disability. If we reach tertiary prevention, it's costly to treat, with diabetes affecting 143 million claims and an average of 8% of total health budgets in industrialized countries. And suffice it to say, 50% of CVDs and one-third of cancers are preventable. And potential years of life lost and a measure of premature death, especially if you compare it to the quality of life of an individual. So the nature of NCDs would be based on natural history. So it would depend on the characteristics of the agent and host, time frame, nature of the disease, and synergism in disease causation. So characteristics of the agent. For NCDs, it's the absence of a single necessary agent. The disease classification system is either disease-based, organ-based, or manifestation-based. One exposure may cause many diseases, such as smoking may cause and lead to different conditions, and many agents may lead to the same condition, such as the fire, sun, or other chemicals may cause burns. Risk factors are any factor which any increases the risk of disease, either it be behavior, physiologic or genetic, environmental, and social. So it's similar to at-risk behavior. These are activities done by healthy persons which put them at risk to develop particular diseases. There are predisposing factors. These are existing circumstances or factors which influence behavior by providing motivation for health behavior to happen, such as exposure to smoking. Your parents are smoking, it's most likely that you, as their children, would smoke as well. Time frame. It usually has a long latency period. It takes months or years before illness is apparent. So those would mean multiple low dose exposure required to cause illness, and there is no multiplication factor or causative agents. For example, behavior for diabetics, they would have high sugar consumption. So as a child, you learn to eat or drink soda or candies, etc., which will cumulatively accumulate for you to acquire diabetes mellitus eventually in adulthood. Or there's a single exposure with extended physiologic response, such as exposure, for example, to a radioactive agent which may cause a disease, or a combination of both. There could be initiators or promoters in cancer. For example, alcoholism, fatty liver are related causally for liver cancer. And could be a result of other chronic diseases, such as obesity could lead to various conditions such as diabetes and hypertension. Or there are exemptions such as acute poisoning, etc., which would lead to disease by a single event. So it is important in planning studies and having control measures in place. So the nature of the disease is often chronic in nature. So this is either permanent impairment or leaves residual disability. So sometimes in rehab, it would require special training for rehabilitation or long periods of supervision and care, for example, after the occurrence of stroke. So the function of long latency, the slow disease process allows the body to eventually make adaptive mechanisms. For example, if you have a stroke and you have a limited movement of your lower extremity, a way to go around the disability would do circumduction with your legs extended with no knee bending. So residual of disease requires ongoing medical treatment and rehab. And some agents can produce both acute and chronic conditions, such as poisoning. So synergism in disease causation is the effect of two or more agents that carry higher risk than when the two agents carry individually. For example, for lung cancer, when smoking and asbestos would come into play. So non-smoking workers exposed to asbestos and smokers exposed to asbestos, what do you think would have a shorter latency period? So this is a comparison table for your non-infectious and your infectious diseases, their main differences. So for non-infectious diseases, which is the highlight of a lecture, again would be a no single necessary agent. It's seldom agent disease specific, causes are unknown, and interventions often based on risk factors. There's a long latency period, may require multiple exposure, and they produce chronic disease. Acquired immunity is not likely, and diagnosis is often dependent on non-specific symptoms. So this is the Global Status Report on NCDs 2014. And as mentioned in the previous slides, 38 million NC deaths globally, 68% of which of the 56 million deaths, more than 40% are under 70 years old, and three-fourths of all NCD deaths are in middle-income countries or low-income countries. So this is the Global Action Plan for the Prevention and Control of NCDs up to year 2020. So, since we've reached the end of this Global Action Plan, have we actually achieved our target? So, it aims for 25% relative reduction overall mortality from cardiovascular disease, cancer, diabetes, or chronic respiratory diseases. 10% reduction in alcohol or appropriate use within context. 10% of insufficient physical activity. 30% reduction in intake of salt and sodium. 30% reduction in prevalence of current tobacco use in persons aged 25% reduction in prevalence of raised BP or contain the prevalence of raised blood pressure according to national circumstances. Half the rise in diabetes and obesity. At least 50% of eligible people receive drug therapy and 80% availability of the affordable basic technologies and essential medicines. So that major non-communicable diseases are treated. So in summary, this is the Global NCD Action Plan. So countries with funding for these NCT activities by function and by World Bank. So most of the budget would have it as a program: primary prevention and health promotion, healthcare and treatment, capacity building, early detection, surveillance, and rehabilitation. And you will see the differences between countries and differences between low, lower middle, and upper middle, high income countries as well. So what are the socio-economic impacts of NCDs? Again, we cannot separate economic from health issues. Poverty is closely linked with NCDs. The increase in NCDs impedes poverty reduction initiatives in low-income countries by forcing up household costs and healthcare. Again, we go back to the health systems, health economics lectures that we've had in the first semester. And you know that treatment could sometimes be lengthy and expensive, and sometimes the loss of the breadwinner itself is debilitating in the capacity of the family to provide for its own. Especially for vulnerable and socially disadvantaged people, get sicker and die sooner than people of higher social positions, even if they do get sick. They're at greater risk of exposure to different NCD risk factors such as tobacco and unhealthy food, which is a lot cheaper, and they would have limited access to health services. And we have to have a comprehensive approach involving all sectors. Again, it's a holistic approach involving health, economics, policy, education, agriculture, and planning. And our goal is to reduce the risks associated with NCDs and promote measures to prevent and control them. We have to focus on lessening the risk factors associated with NCDs, albeit low-cost solutions to reduce common modifiable risk factors such as tobacco use, unhealthy diet and physical activity, or harmful use of alcohol. Surveillance of NCD and various risk factors, such that high-impact essential interventions through the primary healthcare approach would receive early detection and timely treatment for the patient, thereby reducing the need for more expensive treatment. Policies to promote NCD prevention and control so that we could reorient health systems to address people with NCDs. Pitfalls, of course, lower income capacities for lower income countries to prevent these NCDs. More likely, would high-income countries could cover NCD services covered by health insurance over low-income countries. So countries with inadequate health insurance coverage are unlikely to provide universal access to essential interventions. Okay, so that is the response of WHO, different frameworks for alcohol, framework for tobacco control, etc., etc. So for the activity, so um, for the live class, you must be ready with at least three strategies to address the following NCD risk factors. We will focus on cancer as a strategy, as a disease, so to come up with strategies, but also think of tobacco use, physical inactivity, obesity, diet, and salt intake, and alcohol. Okay? Per group, assign a spokesperson to present in front so that you could present. Okay? And compare the class recommendations with the following WHO recommendations. So for tobacco control, these are price and tax measures to reduce the demand for tobacco, non-price measures to reduce demand for tobacco, protection from exposure to tobacco smoke, regulation of the contents of tobacco products, regulation of tobacco product disclosures, packaging and labeling of tobacco products, education, communication, training, and public awareness, tobacco advertising, promotion, and no smoking. So physical activity and diet. So recommended by WHO would be at least 30 minutes of regular moderate intensity physical activity. Muscle strengthening and balance training can reduce falls and increase functional status among older adults, and more activity may be required for weight control. So you achieve energy balance and a healthy weight. So limit energy intake from total fats and shift fat consumption away from saturated fats to unsaturated fats and towards the elimination of trans fatty acids. Fruits and vegetables consumption, legumes, whole grain nuts, and nuts are recommended. Limit the intake of free sugars. Limit salt and consumption from all sources. Harmful use of alcohol. So, leadership should be committed. So, the health services should have a response. It's a community action. Enforce drink driving policies. Limit availability of alcohol. Prohibit marketing of alcoholic beverages. Pricing policies so that we could reduce the negative consequences of drinking and alcohol intoxication, reduce public health impact of alcohol, and informally produced alcohol monitoring and surveillance. So if this is the national systems response, you see if your government unit has these measures in place. So in the Philippines, there is an NCD program that aims to be smoke-free, smoking, nutrition, sustansya, sigla, activity, and slow sa tagay, avoiding. So objectives would be, again, we will learn in principles of community organizing, arouse awareness so that we could engage institutions to commit to environments that encourage healthy lifestyle. So first, we generate public interest by increasing awareness. Then we encourage the public to make personal commitment. And then we make institutions commit to this life. Targets would be school children in school, in the workplace, and beyond the target market would be 33%. But these targeted school children and workforce would be the people that would eventually be affected by chronic disease. The target market beyond that age, the 33%, would have had the disease by then. So again, prevention is better than cure. Target lifestyle changes early. So smoke free. Be smart, don't start or quit smoking. Make your home smoke free and support smoke free public places. So advocate for the strict enforcement on the ban on tobacco advertising, promotion, and sponsorship. Nutrition, cut back on salt, fat, and sugar, even MSG in cooking. Eat more vegetable and fruits. Don't skip breakfast. And support healthier menus in public eating places. So, do moderate physical activity for exercise. Walk, dance, whatever. Let children do play sports. Now, very sedentary lifestyle. So, if you have medical conditions though, seek your doctor's advice. And support and advocate physical activity or sports. So, drink responsibly or don't drink at all. Don't drink and drive, and advocate for the strict enforcement on the ban on advertising, selling, and drinking alcohol. So we have different partners. You could see it online. We have our champions, we have our partners, events, and other participants. So these are our resources that would help us continue. This is from DOH. So that we could continue our prevention of NCDs. Thank you for listening to this lecture. Be ready for a discussion tomorrow at 3 p.m. Link would be posted in MS Teams. Thank you.